We talked about this too, about you use UV light now for water purification, to disinfect water. Some of the best places. We talked about that the show with Zac Efron and Darren Olien talking about water, right? In France, and you saw those big UV ones in France as they do that, because it's such a natural way to cleanse water from any microbial, things that may be in it. And we know now that one of the biggest things I saw sell out in the last year was those UV wands that disinfect.
The hand wands, yes.
We used them at the center, and we were trying to get more, and you go to, they were sold out. They were because people realize UV light is very effective, incredibly, much more than even the spraying of things. You could just go over it, and is incredibly effective at killing microbes, viruses, bacteria, mold.
And quickly too. It's not like the hydrogen peroxide.
And we also brought up air purification. Some of the best ones are all based on UV light. Even if you look at things like Molecule and new technology, they're based on UV light in a sense. So tell us, we know what this does to all these other elements, but what is it doing to blood? Because some people may say, hey, that seems like it may damage the blood cells. It may do something negative. Is it safe to expose something that usually isn't exposed in our body to these things?
It's a very good question. So what we found is that the only thing in the procedure that we're doing that could harm the blood is being rough. The blood cell is sort of like a thin layer of skin. It's a tube. Let's suggest an inner tube, and that thin layer of skin is laying over top of that inner tube. The minute you break that skin, the cell is dead. So we have to be very careful on the blood, and that was something that was found in the 40s when the knot theory was coming around. His initial device had it dropping a foot. The blood was dropping a foot and hitting, and they weren't getting the same type of results because the dead blood cells, there were too many, and you could not oxygenate those or irradiate those to get it back in the body, because if it's dead, it's not going to carry the irradiation as good ones are. And so our procedure has, over the 100 years, has never damaged anything. It has never harmed anybody. The only thing it will do is that it might make you feel like you have the flu for a few minutes or so. You might get cold chills. And you might get very tired. If you do this procedure as it's working internally, you'll notice that it's making you feel tired. Some patients feel like they're going to run around the block. And it's different. It just depends on what it's working on internally. So as it's cleansing your organs, your vital organs, it's also clarifying your brain. You figure now blood hits every part of your body. So if we're irradiating that blood, it's actually going down to the RNA and DNA level, Casper. And that's what happens. So we've also have studies, and this is going to be very interesting, that I've already seen positive results on this, but I'm going to talk about the telomere for a minute. So the telomere is a DNA strand that when you're born, you have 18 strands on it. As you age, it decrements. When you die, if you die of normal, between 4 and 6 are left of this DNA strand. What we've found is that by irradiating the blood and providing additional oxygen and autoimmune system activation, that the telomere stops the decrementation, and in some cases has increased the telomere DNA strand. So to give you an example, we had a hockey player out of Michigan. He was in his early 40s. He did our procedure once a month for about a year and a half. And the unfortunate thing is we didn't get a baseline test on his telomere. But being 42 years old and the telomere test coming back at 19 and a half tells us that we probably did work some. So we've got 3 patients under the protocol right now, 50, 60, and a 70-year-old. And so I'm weighing that, and we're going to have the results in August and September and October of this year. But I'm sure it'll prove that the telomere will have either stopped decrementing or had increased. So we did get the baselines on them. Unfortunately, the 60-year-old showed that she was 72. the 70-year-old showed that she was 55, so it's not all the same. It depends on your living, like we were talking about before. If you're a good, very healthy person and you don't, you go around and do a mile a day, stay healthy, you eat healthy, your telomere will probably show that you're your age or maybe a few years younger. If you're a person that's abused, you drink a lot of alcohol or wine, not saying that that's bad, but it does take an effect on the body and your brain and the kidney and liver. And so those are the folks that we see that the telomere is actually going to be 5 to 10 years, show that your internal organs have taken an abuse on your living. And so that's what we've seen. It's very interesting on the telomere side.
That's incredibly interesting. You talk about telomeres. That's where everyone's pointing to for anti-aging, right? Trying to live longer. It's all about your telomeres. It's all about looking at that and your mitochondrial function related to that. And that's all where aging takes place, and DNA repair and destruction. So it's really, you could say in many ways that the UVBI, ultraviolet blood, is an anti-aging therapy in many ways. Well,
we'd like to say that, but being an engineer, I'd like to have the proof of it. And when we get that, then we'll be glad to expose it and market it appropriately.